So you've probably heard the news about a new COVID-19 case in Nigeria, and you're looking for some clear answers. Well, you're in the right place. We're going to cut right through the noise and get straight to the facts from the Nigeria Center for Disease Control. Let's break down what this update actually means for all of us.
All right, let's just get straight to the big question, the one that's probably on everyone's mind. Seeing a headline like that, yeah, it can definitely bring back some unwelcome memories from a few years ago. So the real question is, should we be worried? Is it time to panic?
And the answer, straight from the NCDC, is a very clear, very direct no. Their number one message right now is that there is absolutely no cause for panic. But why? Why are they so confident? Well, let's unpack the reasons behind that very decisive no. To really understand that reassurance, we first need to take a look at the current situation as it stands right now, based on all the official information that's been released. You know, what's interesting here is the way they're framing this. The NCDC isn't hiding the confirmed case, not at all. They're being completely transparent. But notice how the message is overwhelmingly about control and preparedness. The situation is already being monitored and response measures have been immediately activated. This isn't a crisis, it's basically the activation of a well-rehearsed plan. And this brings us to what is probably the most significant concern for so many people. The possibility of new restrictions and, of course, that word nobody ever wants to hear again, lockdowns. And the official word could not be clearer on this. The NCDC states it explicitly. There are absolutely no plans for lockdowns or any kind of movement restrictions. This is a huge, deliberate shift in strategy, and it's all based on everything we've learned over the past few years. Yeah, this slide really gets to the heart of why things are so different now. Think about it. The old approach was like using a sledgehammer, right? It caused all this disruption because we were facing a threat we knew very little about. Today, the strategy is much more like a scalpel. It's precise, it's targeted, and it's designed to manage the situation while causing as little disruption to our lives and our work as possible.
So what does this active response actually look like on the ground? Well, it means that as soon as that case was confirmed, systems that have been built and strengthened since 2020 were just switched on. We're talking about active surveillance to find any other potential cases, immediate contact tracing to map out any potential spread, and established case management systems that are ready to go. This isn't starting from scratch. It's activating a well-practiced response.
Of course, a prepared response also means tackling another kind of threat, and that's misinformation. We all know it can spread just as quickly as a virus, sometimes even faster. The NCDC is tackling two big falsehoods head-on here. First, this idea that COVID-19 is just malaria or a common fever. They're clarifying that, nope, it's a distinct viral infection that needs its own specific public health response. And second, that dangerous claim that it's all a scam or doesn't exist. The reality is, it's a known condition, and pretending it's not just undermines everyone's safety. So the takeaway here is really simple. Before you share something, just check the source. Is it coming directly from the NCDC or another official body? If not, it's probably best to just ignore it. That's how we all stop rumors from causing unnecessary fear. Okay, so the NCDC has a plan. But what about our role in all of this? Because public health isn't just a government job. It is absolutely a community effort. And the good news is, these steps are simple and very familiar. These are just the basics of good hygiene that help prevent all sorts of illnesses from spreading. We're talking regular hand washing, covering your mouth and nose when you cough or sneeze, and making the responsible choice to just stay home if you feel unwell. The NCDC also advises considering a face mask if you're in a crowded or poorly ventilated space. Simple, effective actions we all know how to do. Beyond those personal steps, our collective defense has a few key pillars. Vaccination is still a vital tool for reducing the risk of severe illness. Community leaders have a huge role to play in sharing accurate information, not fear. And it all builds on this really powerful idea of collective responsibility. It's the understanding that the simple, smart actions we all take as individuals add up to protect the entire community. And this is the bottom line. This is really the ultimate takeaway from the NDCD's entire update. Thanks to better knowledge, better tools, and stronger systems, the country is in a much better position to manage this. This isn't just reassurance, it's a statement of capability, born directly from experience.
So as we wrap up, the focus really shifts from panic to participation. The message is clear, the systems are in place, the plan is active, and the final piece of the puzzle is us. It's that collective responsibility we talked about.
And it leaves us with a question to consider. How will you play your part in maintaining community health?